for Warringah.
According to the Butterfly Foundation, 1 million Australians are currently impacted by or living with disordered eating. I've had constituents reach out to me with their concerns about the prevalence of eating disorders and seeking help for treatment of their children. Globally, 1 in 5 children and adolescents have signs of disordered eating. There is shockingly a high volume of Australians who are impacted by the complex and dynamic disorders. Less than a quarter of those people are receiving the help, support and intervention they need. More needs to be done to extend the existing targeted mental health support and treatment to those who need it. My team and I have engaged with experts in the youth mental health space, and I wish to thank organisations such as Reach Out, Professor Pat McGorry, Professor Marie Thiessen, the Society for Mental Health Research, for their work in this space and for sharing their insight with us. Disordered eating can be incredibly varied, and the symptoms may not always be apparent. While anorexia is the most talked about disorder, binge eating and bulimia are actually the most prevalent. We need to break down the stigma around these and enhance public awareness of these ailments. Symptoms can be incredibly subtle. We need to know the warning signs, including meticulous calorie kilojoule counting, ritualistic eating times or routines, excessive exercise, fear of eating in front of people, fixating on safe foods only, including strange combinations of foods. Every member in this parliament represents people in their electorates who are living with eating disorders. It's our responsibility to urgently address the rise in cases and, just as importantly, the amount of treatments that are available. Genetic vulnerability, psychological factors and socio-cultural influences have all been identified and leading causes of disordered eating. Some areas of our community that are at higher risk than others. For example, in sports, athletes have a higher prevalence of disordered eating, and up to 45% of females and up to 19% of male athletes experience disordered eating. The National Eating Disorder Collaboration has been working with the Australian Institute of Sport to tackle this issue, which was exacerbated when training programs shut down during COVID. But we saw that impact our youth in general as well during COVID, because those lockdown periods meant that young people turned to what they thought they could control in circumstances where so much was beyond their control. And unfortunately, we've seen a dramatic increase in numbers. Since the beginning of the pandemic, some hospitals have recorded between an 80 to 104% increase in children with anorexia. It's also well known of how impactful social media can be on young people. Young people are bombarded by perfect people with perfect bodies and perfect lifestyles. The constant exposure to significantly filtered and edited images does indeed warp our perception of what is authentic and what is augmented. There are treatments that can help, although some eating disorder journeys can take a long time towards recovery. And we know that these impact not just those that are impacted directly, but their families, the wider circle. It often means parents taking time out of the workforce. It means disrupted studies and ability to work and to support the rest of the broader family. We know there is a severe shortage of mental health workforce, and the workforce treating eating disorders is factored into this. General practitioners are generally the first point of contact for treatment, but again there is a shortage here which is widely acknowledged. Currently, Australia only has one dedicated residential treatment centre for eating disorders in the entire country. Reach Out's research suggests that friends, family and the internet are where young people are turning when seeking mental health support. A simple Google search can often be the first step to connecting with a service that can make a profound difference to someone's mental and emotional well-being. So more attention should be given to digital connection and interaction with mental health services. These innovations, whether it be telehealth or Reach Out's peer chat program, see really promising results in access to services. Some people prefer discretion, anonymity and comfort of accessing support in their own time from their own homes. So I welcome the commitment of $20 million by the previous government to creating creative treatments for eating disorders and encourage further focus by this government to increase access to services.